So you talk about not rushing off, the building, getting the infrastructure, whatever you need in place. What we often talk about here at the healthcare conference is technology and the transformation or innovation that can bring on. What technologies are working particularly well in these would sound like mobile hospitals initially, and then become some fixed hospitals over time. But what technologies have helped or changed your ability to care?
Well, for a lot of people, the word technology signals gadgets or something, and those are critical too. Devices, electronic medical records. I understand there's someone here who was presenting earlier talking about electronic medical records in West Africa.
Helium Health. Yeah.
Helium Health. Well, we devised an open source electronic medical record about 20 years ago and have rolled that out in most of the countries where we work. And the places where we didn't, it's because they already had some other electronic medical record. But I think it's much more helpful not to think of gadgets and to think of, the categories that I use, and most doctors would, are what are new technologies in prevention? Like what happens when you have a new vaccine? It's a new technology. Cervical cancer should not cause the mayhem it does if people have access to the HPV vaccine. So that's a preventive, and then there are diagnostics. If you have a new molecular-based diagnostic platform and don't have a plan to roll it out to serve those in greatest needs, then the effectiveness of that new technology is blunted. And then, of course, therapeutics. And what came to mind in 2012 or 2013 and came into the markets was effective and curative therapy for hepatitis C. So in each of those instances, new technology, whatever it is, what's our equity plan? Because if you don't have an equity plan, and by the way, just to demystify it, it wasn't straightforward to me that the biggest supporter of transfer of technology would be George W. Bush. But when he launched PEPFAR, President's Emergency Plan for AIDS Relief, that not only saved millions of lives, and still is, but prevented tens of millions of new infections, including mother-to-child transmission. That was an equity plan, coming in the view of some from an unlikely source or inspiration.
A government equity or?
Well, when you take that therapy and invest the resources, whether it's through a government, a public sector, hospital or clinic, and most of the work we do is with the public sector as our partners, or in any other mission hospital, the distribution mechanism could be, a FedEx or Coca-Cola, whatever. When you don't have an equity plan, what you see, which I would like everyone to be troubled by, is a widening outcome gap, right? So if there's no treatment for hepatitis C, poor people will do more poorly anyway. But once you have an effective curative therapy, and if it's only available to those who can pay for it, and the cost, the market costs here are astronomical, then that means that there's a widening outcome gap. So inequality, in a way, becomes worse, which is why, that's why I was thrilled to be invited here, is because we can't do that without private sector partners, businesses, people who know how to roll out technologies. Yep. So we have a lot of need on that front, support from the private sector, both the managerial aspects, but also the tools of the trade.